Yeah, so people that are generally blonde hair, light eyes, or even red haired, people that have had a lot of sunburns or a lot of sun exposure in their life, people that have grown up here in Southern California and have surfed or hiked or have been cycling most of their lives are definitely at risk. If you've had more than 5 sunburns, you double your risk of a type of skin cancer in your lifetime. People that have also, for whatever reason, they're on some type of immunotherapy, something that suppresses their immune system, puts them at greater risk as well. And if you've been in one of those tanning booths before the age of 35, you've increased your chance of developing a skin cancer by 60%.
Oh,
I know. So I think that we're seeing, obviously, our detection skills have gone up. We're more aware. That's why annually there's a 31% increase in detection of melanoma for the last decade. Yearly, we've been seeing an increase in, and perhaps it's because of our detection skills, but also because we're seeing that population that really use those tanning beds now going into their 30s, 40s, and early 50s.
So just a couple days ago, we had a doctor in studio talking to us about how lung cancer is the deadliest because it's found so late.
Yes.
Talk to us about how early skin cancer can be detected. What are some of the signs and symptoms we need to be aware of, and what can we do if we find that something doesn't look right?
Luckily, the skin cancer that's most common is called a basal cell, and it generally does not spread or metastasize. You can generally just cut it out, which is wonderful, and it's localized, but it's also inconspicuous. And so people think it's just like a little mole because it's going to be just skin colored, a little skin colored bump or something that looks a little pearly and may have been there for a couple of years and not really grown, and can have just an overlying blood vessel on it. So that's the most common type, but also the one that gets disregarded the most. The second most common type is called a squamous cell. This one's a little scaly. When you put your hand over the area on the skin, it feels like a rough patch, and if you pick at it, it can bleed. And that in some cases around the lips or around the ears can spread a little bit more readily. And then the one that we're always most concerned about, which luckily makes up less than 5% of all skin cancers, are melanomas. The concern there is that it can, once it does metastasize or spread, it can be deadly. But as you had mentioned, these are all preventable, especially if you catch them early. You can minimize their chance of spreading.
So the best ways to prevent it are really just paying attention to changes in your skin.
Yeah, so monthly skin self-exams, right? So like going, when you're in a changing room at a department store, getting in the habit of taking a look, especially on our back, because people tend to forget the back. In men, skin cancers tend to happen along the back, women along the legs. And so those are areas where you can kind of take a look at that back area, or have a spouse or loved one that likes you to take a look at those areas. Reapplying your sunblock, very important. We forget, people say, oh, I just wear my SPF 50. If you apply it once, that's not enough. You have to reapply every, ideally, hour and a half, at least 2 hours to really get that SPF. And then going to see your dermatologist once a year, especially if you've been brought up in Southern California, Arizona, you've had a history of all the risk factors that we just talked about. Definitely a good idea, because you might disregard something as I've always had it all my life, but a melanoma could arise from a mole that you've had all your life.
So I always think we're invincible.
Exactly, and that's the reason why it's more common in men than in women.
Yeah, all right. Dr. Fabi, thanks for the insight. Very important. Thank you.
Nice seeing you.